Okay, welcome to today's webinar. And in today's webinar, I want to talk to you about something that we homeopaths sometimes underestimate, and somewhere where homeopathy is just unbelievable, which I have experienced, I have given in. It has been beyond my expectations. So, I want to talk to you about neurological diseases and homeopathy, and especially about stroke. And what often happens, because I show a lot of neurological cases all across in my workshops, in my seminars, is that I get a lot of phone calls, I get a lot of emails where they send me cases where you want me to suggest you the remedy in coma, in strokes, and homeopathy helps often, and very often it doesn't help. So what is it? What's happening? So I just thought I'll make a short a video on it, that homeopathy has remarkable results. When I say remarkable, it has about 10 to 15% results in coma cases. And 10-15% is a very high percentage in this type of cases where the prognosis is very bad. Once Sarabhai Kapadia has said, in any type of case, homeopathy can make a change. How much change? That the homeopath and homeopathic remedy decides. The one thing that I request most of the people who send stroke and coma cases to me is that it has to be within 48 hours of coma, 48 hours of stroke. That is where homeopathy has the best chance. And often we need a hospital setup where homeopathy can be given. And often homeopathic medicines that we prescribe is often given locally on wrist and ankles with a local application. Or in some cases, it can be given as a olfaction. Basically, in this type of cases, the family has to be taken in confidence, where homeopathy has to be given along with whatever is the patient being admitted in hospital, because we need some other source of line of treatment also along with homeopathy in that cases. So I want to talk to you about some commonest remedies that I use in stroke, and these are not the only remedies. I use plethora of remedies. In fact, I'm writing a book on neurological cases and homeopathy. One of the top remedies that I've given in any kind of stroke, even a minor stroke, is arnica. Remember one thing in neurology, you have to use remedies in high potency. You can't use 30. For arnica, often 10 and 50 in any type of case of stroke, coma, early coma, when there is no indication, but there is a history of injury, or there is a edema in the brain. The first remedy is arnica 10 6 hourly local application and olfaction. Other than what Allen has written, if there is any other indication for any other remedy, then you can think of another remedy. One thing that I've seen is hot head and cold feet. This is a common indication I've used. And during the stroke, there is an involuntary urine or stool. If you get this, straight away start with arnica. Arnica people are very defiant, very obstinate. So that's the type of personality I also look at. If you see the rubric defined, you'll see arnica. Another remedy that I use very often is hamamalis. It's a top remedy when arnica fails in stroke, and I've used it a lot, especially for wounds. But the remedy I want to tell you, especially for a thrombotic phenomena, one of the very important remedy when there is a lot of hemorrhagic stroke, is Crotalus horridus in very high potency, 10 It is a very important remedy for coma-like stage, exhaustion. I had a case of hepatic failure with Crotalus horridus 10 The patient came out of it, and I have videos, documentations with everything. Remarkable. One of the main symptoms in that case was constant talkativeness, delirium talkative, delirium loquacious. That's Crotalus. Carbovage. This is another remedy that I use, but I often use it in a very high potency in cases of coma, 50 But more than coma, this remedy I've used in multi-system failure. When more than coma, there is a multi-system failure. I used in very high potencies, Carbovage. One of the key feature I've used in Carbovage, except for the typical symptom, is there's a history of a lot of attachment to someone, and that there has been a detachment with them. The emotional level, this is very important. And definitely the coldness, the need for fanning, all this is there. The remedy which has brought me the biggest name in cases of coma is pitutrinum, especially when you're given arnica, opium, carbohydrates, because that's the remedy homeopaths generally give when they contact me. I have given pitutrinum in very high potency, 1 m, 10 m, because this remedy has the power to stimulate the brain. Remarkable. It has the power to check the hemorrhage and absorb the clot. Remarkable. Amazing. Another remedy, bothrops, especially in cases of in a stroke with thrombosis, followed by hemiplegia and aphasia. This is the top remedy. Bothrops. Another remedy, Chenopodium antihelminthicum, which is one of my favorite remedies. You know why? And another interesting remedy that you should know is calibromatum for post-stroke hemiplegia and aphasia. One more remedy, we don't use it often, is Cenchrus contortix. Again, it is a mixture of arsenic and lachesis. Melilotus alba, especially after arnica when there is a congestion of hemorrhage in the brain. You think about Melilotus alba. I've used it very nicely. I've also used Carbo animalis very well. Remedies like lachesis. But the remedy I again talk to you about is pitutrinum in high potency. High potency is work. And my guru in all these cases is a person who's not alive. His name is Magan Bhai Desai. He's written a book on coma, and it's an amazing book. It's a book I really want to encourage all of you to read. That book opened my life about neurology and coma cases. So, in cases of stroke, homeopathy has a role, but there is a way of doing it. There is a way of looking at the Glasgow Coma Scale. We have to take the allopathic doctor in confidence, and in future we need a homeopathic hospital.